This conference will now be recorded.
Okay, good. We are recording, and I'll call the meeting to order. The first is to approve the minutes of the June 3rd meeting. And Sarah, thank you for sending them out. Did everyone get a chance to look at them? Any comments? Spelling errors, anything? Okay, all in favor of approving the minutes?
Aye.
Looks
Aye.
good. Okay. Okay, well, let's go on to really why we're here. We're going to discuss and vote on COVID-19 expense reimbursement from the state of Connecticut. The state established the Municipal Coronavirus Relief Fund to provide municipalities with reimbursement for COVID-related expenses. And Jen Charnetsky is here tonight to talk to us a little bit about those expenses and give us a little bit of an update. So Jen, are you on?
I am.
Okay.
So in the original backup that Max sent to you from my April 25th memo, it has been updated a little bit, but that does give you the basics. Through June 30th, between the town and the Board of Education, we've spent about $490,000 on COVID-related items. And we were capturing anything that we purchased or incurred an expense on solely because Corona happened. So we just aggregated all of those. It was about $490,000. We have multiple funding streams for reimbursement. We had got about $6,000 from the Secretary of the State. We were able to submit about $5,000 under the Health Department Preparedness Grant. The schools received just about $135,000 from some federal money that flowed through the state. That's the ESSERF money. The local health district grant, originally we were estimating at $19,000 because we were still trying to nail down exactly which expenses were eligible. I think it ended up being about $16,000. And then our big item is FEMA. They will reimburse us for about 75% of eligible expenses. Most of our purchases were things like cleaning items or cleaning supplies, office modifications, the police overtime at our testing site. All of those were eligible under FEMA. So finally, we come to the CARES Municipal Coronavirus Relief Fund through the state. They have allocated us $40,282 to cover expenses through June 30th. But first, we have to have exhausted or at least maximized the local health district grant and our FEMA money. We cannot submit anything to CRF that would be FEMA eligible that hasn't yet gone to FEMA and gotten a decision. So since August 25th, you have a few changes. One is the local health district grant. The most significant change is that we do not yet have our second FEMA claim submitted. We submitted one on May 22nd and we've gotten a decision on that. Our emergency management director is working on the second one, but it's a combination of town, Board of Ed. It's a lot of information to enter. And he's been working with FEMA on Tropical Storm Isaias information. So he's been a bit taxed on his time. So at this time, all we can do is submit to CRF for items that were included in our 522 FEMA claim or that wouldn't be eligible under FEMA. So we do have some overtime categories that weren't eligible under FEMA that I've included for the CRF submission coming up on September 30th. So the final number on that is what Max sent to you this morning. It would be a submission of $26,277. And the deadline for submitting is September 30th. But the state has been in contact with FEMA. They know that towns couldn't get everything in right away and that it's a lengthy process for FEMA to review and decide on the applications. So they have extended the deadline once. I'm hoping that they do so again and we can capture the second FEMA claim and get our full $40,282 from the state. But as it stands right now, what will be eligible to submit by September 30th is the $26,277.
Well, just to be clear, Jen, that number I see is $26,222 excuse me, one more time, $26,227.
Oh,
Is that the
sorry,
number?
you're probably right. Let me just double check that. I wrote it down and I could be.
That's all right. So that's the number, but should we
Yeah, 227.
come up with a larger number just to cover it?
What I would like, so part of this submission process is I have to certify that this has been approved by our legislative body, which is the RTM, and that it's reflected in the minutes. My preference, so that we don't have to come back to you if they extend the deadline, is to approve a submission up to our full allocation of $40,282.
Well, that seems to make sense. To approve that number, and then if if you're just going for the 26 now, but if you get the full thing, you don't have, like you say, you don't have to come back and we have to have another meeting just for that.
Right.
Would you like a motion, Mr. Chairman?
Sure.
I would move that the town seek its full compensation from the CRF fund totaling $40,282. Jen?
Yes.
Question
Yep.
mark? I think Lois was seconding me.
Okay.
Second.
All in favor?
Aye.
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 Can't see Penny, but I assume Penny's a yes.
I'm yes. I don't know why you
Okay,
can't
good.
see me, but I am a yes.
And how about Holly?
Yes.
Okay,
Can you hear me? Yes.
that's all right. So Sarah, do you have that? Okay, good. We're all good. Well, Jen, well, thank you.
Thank you very much.
And we don't want to see you again, so this
Have a
covers
good
it.
night.
No, thank you. Thanks for your time. Thank you.
You're very welcome.
So I don't have any real announcements. I don't know if anyone else has any. I know that I did touch just a second ago on the advisory board of health meeting that we had yesterday. It just, I can report back that there's going to be more concrete notes on it, but David Knopf was very pleased that the numbers in our town are extremely low. There's just very few new cases of coronavirus. It's all very encouraging. There were 5 deaths in the town that happened, I think, back in April, and we haven't had any since. And it's just feels very good. There's been very few cases of hospitalizations, so it seems to be all good. I think he's been inspecting the restaurants that are open. That's all back to regular inspections, and he feels very comfortable that people in town are wearing masks. I mean, his observations and everything. So I think everybody's doing a good job.
Mac, I can send everybody a link to the Vimeo copy of the meeting, which we aired last night. It's only 39 minutes, but it's mostly poor David detailing the tsunami of his life in the past couple of months, because he does talk about flu shots.
Right.
He talks about allegedly flesh-eating bacteria in Long Island Sound. I mean, there's all kinds of good stuff. So I'll send everybody the link. It's on Vimeo, and it's a quick meeting.
No, it's great. Thanks, Jim.
Sure.
So that was the only one item we had on there. I don't know if there's anything else anyone wants to bring up. And we may be having a meeting in October. I'm just not sure yet, but that there is an RTM meeting scheduled for October, so we would have a meeting. And I'm happy to do these meetings the way we're doing them, but we could also room 119 is available if you want to try to do an in-person meeting. But we could. I see Lois saying no. So, but that's something that's available. Some groups have been meeting, so I just throw it out there. But if everyone's happy doing it this way, that's fine.
Mac, I have a question on the health department. When they give the stats, do they give the neighboring stats also? Because just because we're really good doesn't necessarily mean that, we can relax because we've got Stanford.
Yeah, I don't. I don't know who that is, but I don't recall in the meeting that he talked about other communities, but that's a good question. I'm sure they're out there. He just was kind of basically just touching on Darien specifically, but I'm sure he's privy to data from the other communities as well.
I mean, originally I thought the site had some really good information, the state site, and then they revamped it, and I can't find what I was interested in looking at, like what was really going on in the other towns.
Okay.
But, you know, if maybe before the next meeting, if we can get an update that includes the
Sure.
impact in other towns.
Sure. And if, you know, if I get anything back from David, I'll forward it to everybody.
Thank you.
Okay, you're welcome. So, and if nothing further, I suggest that we adjourn.
So moved.
Okay. All in favor? Great. Okay. Well, thank
Thank
you,
you.
everyone.
Okay, thank
Appreciate
you.
it. And you know, I'll do a brief report on what we voted on tonight and present it on Monday night at the full RTM. So.
Not the
Okay.
full RTM, is virtual?
I believe so. I'm pretty sure it is.
Yes.
I received my packet in the mail today, but I didn't open it. But yeah, I believe it's virtual.
And you have to pre-register so that when you come to the meeting that night, you can get in easily. So there's a link on the paper document that was sent out. It's also linked on the town website. It's a very quick pre-registration, but do it before Monday night so you can get in.
Okay.
Thank you. Thanks.
Okay.
Sounds
Great.
good. Thanks.
Okay. Well, thanks everybody.
Good night,
Thank you.
everybody.
Thanks.
Have a good night.
Have a good night. Bye-bye.